Good morning, everyone. Welcome to our Child Care Provider webinar for Alabama Child Care Providers and those across the state who serve and support them. We're going to take a few minutes to continue to allow everyone to be sure they're logged in and ready to go. So again, thank you for joining us, and we'll be starting momentarily.
Few more minutes for everyone to join us. I want to make sure everyone can hear our audio well, so let me know if we can hear anyone. We're not talking currently, so make sure everyone can hear. Good. Yeah, we're going to wait just a few more minutes for everyone to join us and we'll get started.
Okay, in the interest of everyone's time this morning, we are going to go ahead and get started. I'd like to invite Stephen Warner, Executive Director of Voices for Alabama's Children, to provide our welcome and opening remarks. Stephen?
Good morning, folks, and thank you so much for joining us. It is an honor and a privilege to host this for the child care community across the state. Voices has served for almost 30 years as the advocate for Alabama's children in Montgomery and across the state, and we are delighted to host a platform where we can give our state agencies and a number of other experts an opportunity to share what's going on currently. We thank all of the presenters that will be presenting today and are hoping to provide some clarity and some support for each of you across the state as we deal with these challenging times. Thank you for what you do. Thank you for the support you provide for Alabama's families. And it is an honor and a privilege again to host this today. Joan Wright with Childcare Resources, my partner on the screen, is going to facilitate today, and we will pass it off to her. Thank you so much, Joan, and
Sure
take it away.
Again, good morning and welcome. I'm Joan Wright, Executive Director for Child Care Resources in Birmingham, Alabama. We serve 4 counties up here: Blount, Jefferson, Shelby, and Walker. Just want to make a quick test. Those of you out in the audience, are you able to hear okay? And if not, please send that in the chat. You do have a chat feature available to you. It should be in the right-hand corner of your screen, most likely. Just let us know if you cannot hear us. I'll pause for just a moment. Excuse me, I'm going to just adjust something for one moment. Okay, so we're going to go ahead and proceed. And again, we thank you so much for your time today. We thank all of our speakers who you're going to hear from as we go throughout the presentation this morning. I'll be introducing them as we go along. We have several folks for you to hear from today, and we hope that this will be a meaningful opportunity for you to continue to support the important work you're doing, especially amidst these very challenging times. I'm going to pause for just a moment. Having a few technical difficulties. Hold on just a moment. Okay, we're going to go ahead now and introduce our first speaker. We're delighted this morning to have two representatives for you to hear from Alabama Department of Human Resources. They are good friends of mine. I'd like to introduce them to you. Jennifer Janell, she is the Childcare Services Division Director, and Stacy Sorrell, Assistant Division Director. And they have some important information to share with you this morning about DHR licensing guidelines during this challenging time, as well as some information on subsidy and other information they want to share. So I'm going to turn it over now to Jennifer and Stacy. Thank you for being with us this morning.
Everyone, I hope that you can hear us, and if you cannot, but we are thankful for the opportunity to be with you. My name is Jennifer Janell, and I'm the Division Director for Childcare Services. And Stacy here is joining me. Stacy Sorrell, she's the Assistant Division Director and our Licensing Administrator. We have been working diligently to continue to serve our child care community during this unprecedented time. And I'm going to go ahead and turn it over to Stacy and let her give some updates to you about licensing, and then we'll talk some about our child care subsidy program.
Good morning. I hope all of you and your family are healthy and well. I'd like to begin with just a reminder to have everyone, if you have any questions concerning licensing or minimum standards, instead of talking amongst each other, please call our intake number. That number is 1-866-528-1694. And we have someone on duty 8 to 5 every day, Monday through Friday. So feel free to call us and ask any questions that you might have concerning licensing. Also, I wanted to touch base about that the CDC has released some new supplemental guidance for child care programs, but that choose to remain open or that are deciding to open back up. I'd like to remind you that if you follow anything, make sure that you always adhere to any minimum standards that are applicable to whichever type program you are. And I'd like to touch bases on a few of those reminders for you. For child care centers, remember, children younger than 2.5 years of age must always be grouped separately from children over 2.5 years of age. Also, if you choose to use hand sanitizer, please remember that you will need written permission from the parent on the medication form giving you authority to use this hand sanitizer. And then also remember, when not in use, you should lock it up. Okay, store it under lock and key or combination lock. If you decide, another recommendation from the CDC was setting up possible sign-in and out stations outside maybe your facility so that you could limit the people inside. If you choose to do that, just remember you still have to have a sign-in and out sheet, and parents still need to use their full signature, and we still will not accept initials. The next thing is, another recommendation was possibly finding a way to limit the exposure of parents inside your facility. So remember that children still have to be escorted to and from the facility by a parent or guardian or another designated person. So if you decide to do this, make sure that this person is at least walking the child to the door of the facility and then turning them over to a representative of the facility. That way, the parent is taking responsibility for safely getting that child in and out of the car and across that parking lot. So just remember.
All right. So I wanted to give everyone an update about where you can find resources to help you during this coronavirus pandemic. If you will go to our website, dhr.alabama.gov, and if you will, the childcare page, you will see a whole list of resources for providers, for families, and for our childcare subsidy providers to give you resources on operating during this time. One thing that we have on the website is a map of open facilities. You can search by zip code, you can search by location. And so we're trying to make sure that we have made available to families the opportunity to see where they can get care right now. And so if you are a provider and you have opened back up or you have remained open and you are not showing up on that map, if you will make sure to let intake know that you are operating so that we can keep that map as current as possible for the families that do need care during this time. Okay. And so also on the website, we also have our memos that we have sent out in regards to our Early Head Start Child Care Partnership Program, our child care subsidy providers, as well as our providers providers operating in general. As Stacy mentioned, the guidance from the CDC, we have included a link to that there, along with some reminders about how to make sure you're staying in compliance with the licensing standards. I do want to review very briefly the memorandum that we issued on April the 3rd to those providers who are participating in our child care subsidy program. And effective April the 6th, and this is going to be all the way through May the 8th at this time, providers that are participating in the child care subsidy program are going to be receiving a weekly sustainability payment. That weekly sustainability payment will be equal to 50% of all the subsidy children enrolled in your facility. The first time that you should see that direct deposit will be the direct deposit that you receive on May the 4th. Our payment dates are in arrears, the settlement date, and so, but it will be for Care Week effective April the 6th. Our absentee policy has still been suspended through May the 8th, so parents will not be required to back swipe attendance, and we will cover those absences in excess of 5 days a month through May the 8th. We are not authorizing any additional emergency closures, but providers still have the 5 emergency closure days that they're routinely given each year. Again, providers who choose to operate must comply with our licensing standards here at the department, as well as any health orders from the state health officer or any local proclamations as well. And in those facilities that are remaining open or choosing to open back up, in addition to the weekly sustainability payment, they are also receiving payment for children who attend. But in order to receive that regular payment for children in attendance, children must be swiped in and out each day. There's no exceptions to this mandatory swipe requirement, and TAS adjustments are not going to be accepted for this emergency time period. So the children, in order for you to receive that payment for attendance, the children must be swiped in and out. We do ask that you are keeping your local child care management agency in your region updated with your closures if you're choosing to remain closed. And just as a general reminder, as always, TAS swipe cards are not allowed to be in the possession of child care staff. Parents are not allowed to leave those cards on the premises. and providers are not allowed to swipe those cards. So those are just a few of the reminders that we wanted to bring you from our department, and I'm going to turn it back over to Joan. And thank you, Joan, again for the opportunity.
Some technical difficulties, our apologies. We are working on getting Joan backing up. We appreciate the information from DHR. For those of you who have questions, we are recording this. The audio is working on the recording, so we'll be sharing that out to all the attendees as soon as we can. I want to present our next presenter, and this is 2 seconds. It is our Chief Medical Officer from the Alabama Department of Public Health. Doctor, if we can get you up and running, we wanted to give Alabama Department of Public Health an opportunity to share a little bit of good information about their public health order, as well as any guidance they can give us on effective cleaning in childcare centers that are open. So can get the doctor up. There we are, doctor.
Well, good morning, everyone. We've had several, I guess, amendments to the order over the last few weeks. And a lot of that is to actually deal with and address the changes that have actually been occurring from the federal standpoint. You all know that we started out with when the information was identified that there was with seeing the cases that were in China, and then the information related to the first cases that would occur in the United States. So that now we've become the state with the country with the highest number of confirmed cases, and that's in the United States of America. So there's also, from the standpoint of Alabama, where we actually have been, we were able to stand up the state lab to have testing within our state on March the 5th. And so we've been testing a little bit over a month now, and we are over 2,000 when it comes down to confirmed cases. We have a dashboard that is available on the Alabama Department of Public Health's website. And that dashboard, we continue to try to figure out how to improve it. But the dashboard actually contains information related to the total number of confirmed tests, the total tests that have been confirmed, done to date, and we're over 20,000 now. We started out slow due to problems with getting the actual reagents to do the testing within their laboratories, to get labs stood up, and at the same time to have the ability to have something as simple as a nasopharyngeal swab to collect a specimen. That took us almost 3 weeks to get sufficient swabs to be able to put together kits so people could have specimens collected. So those things are kind of smoothed out some. There are still issues with getting appropriate personal protective equipment for staff to be able to have so that they can continue to see patients. There are issues related at scarce resources for the hospitals. We are also asking and recommending, based on a recent change that occurred just on last Friday, that any persons that are going out in public, okay, that are not within their homes, that they start wearing a face covering. We do not want people to use the mask that we need to have available for the healthcare providers. We want you to use, you can use a bandana, you can use a scarf that you have that you can put where it covers your nose and mouth. You can make them. There are actually even instructions, not just on YouTube, but how to make it, but even on the CDC website, they now have, as of, I want to say maybe Saturday, an actual indication of how you can make one from t-shirts to be able to cover your face, your nose. So those are recommendations and stuff that we're asking people to do. In saying that, because you all are dealing with children and the whole potential of they don't appear to be getting as sick, but some of them can get relatively ill, especially those with health issues like asthma. And so what we're recommending that now, if you're going to be in those settings, that you can use those whole handmade masks. We don't want healthcare providers to use them, but it can help reduce the risk of transmission to other people by doing that. So if you have access to any of those masks, at one point there was really not a recommendation, but now there is, to basically cover the face. Okay, so if you're going to be in settings where there's multiple people, and the recommendation for social distancing still applies. Now I know how hard it is with children, but there is some information specifically on the CDC website for child care programs. And it talks about what needs to occur from the standpoint of social distancing from a child care or daycare setting, and about making sure that, you're not having the children facing each other. If at all possible, they should be so that the chairs are facing the same direction, so that they don't have the potential to potentially sneeze or cough, so that they're actually being located from in this direction. So you really want them so they're lined up, so that you can reduce the risk of the potential of that transmission. There is stuff there about staggering playtime, keeping the numbers down within the setting, so that they're not more than 12 within a single room location. Making sure that you are periodically getting them to wash their hands, okay? Because the hand sanitizers are not readily available anyway. And even if they are, I understand that you have to go through other things to be able to allow children to be able to use them. But there's nothing to say that let me take a child one at a time and make sure that I'm periodically making sure that they're using soap and water to clean their hands throughout the day. That can actually cut down on the whole risk and problems. The issue with cleaning and disinfectants, and the fact that they are extremely difficult to come by brings up the issue of the need to be able to know that there are alternatives out there. You all have a list that's recommended for use within the daycare setting, but it also recommends and says that in the absence of, like being able to create a bleach solution, that there are other alternatives. So those are things that you really need to be pulling and looking at from an EPA standpoint, and what's safe in a child care setting that would being used. You can create your own from the standpoint of the ones that are there, from something as simple as using being able to do hydrogen peroxide with the microfiber cloths if you don't have access to be able to get the bleach to be able to do the diluted solution for cleaning. Anything that's touched, okay, or the potential for kids to be able to handle and put them in their mouths. I have grandchildren now too, and we have to make sure that those things are being cleaned routinely. Things that you would not even normally think of having to do that with, but it needs to be occurring. If they're going out on the playground, somebody needs to be wiping down that equipment that they're getting on. And the other thing is making sure that there's some staggered arrival and drop off time, so that not everybody is coming in or trying to come at the same time. I heard at the initial speaker talk about the ability to make sure that they still had sign in, sign out, that kind of thing. Something as simple as putting something to clean the pens with routinely, because people don't often think about it, but pens can actually harbor the infection. So if you've got a single pen that people are using, they need to have the ability to be able to clean and sanitize after use their hands, because there's a potential for infection to be picked up from something as simple as signing in with a pen. When it comes down to with your staff, the reality is they really need to keep on a face covering at this point in time in dealing with children, even if they don't consider themselves to be high risk, because they can also be a source of transmission, even if they're not initially symptomatic. It can take anywhere from people can be what we call transmit infection in a pre-symptomatic phase Initially, it was said about 2 days before the symptom onset that you could be infectious. Now it may be as long as 3. So that's extremely important. And the last thing I wanted to mention from that standpoint is that the most common symptoms, okay, and the ones that pretty much everybody will have, even if they present or have other ones, cough, fever, or shortness of breath. Those 3, those are the things you look for. Now they can get GI symptoms, diarrhea, all of those, but usually they still have one of those 3 in over 90% of the presentations, even if they have other things like the body aches with severe muscle pain, not just body aches that we normally think of, but those are other symptoms included. So you asked the question about with the health officer's order, and we've talked a little bit about the social distancing within the daycare center. And then there was a question asked about essential versus non-essential people. And that's pretty much something that the Attorney General's office is working through. But when it comes down to your daycare centers, is anything that you're going to need to allow to keep people to be able to continue to operate. There is a phone number for the Attorney General's office specifically for questions related to essential versus non-essential, if there's any questions, and that's 242-7300, 334-242-7300. They have actually stood up a call center similar to what we've had to do in multiple ones. We don't have just one, but they stood up with the ability to address questions that people may have related to the health order, specifically about gatherings and what they need to do. Is there an exemption process? All of those things. Okay. And that's it.
Dr. McIntyre, thank you so much for that great information. I'm just going to quickly type that number you shared to the Attorney General's office. It's 334-242.
Yes, 7300.
7300. So that's now appearing in the chat. We're doing great on timing so far. Everyone's been keeping with their speaker schedule. So a couple of questions that came in on the chat is, should staff be checking for temperatures and such like that of either staff or
I mean, it's really recommended. I'm gonna say this, that, and we're doing it with even our staff. Now, we're not, what we do with them, with the ones that we've got home health nurses, that type of stuff. We ask them to fill out a symptom screener every morning, basically to check their temperature and also identify whether they have any of the symptoms. If they do, they're to contact their supervisor immediately, because we need to then determine whether or not we need to get them in to do something else, you know, from a test standpoint, and also to get someone else to cover the patients. So that needs to be occurring. We've recommended that for anywhere where there's a potential with multiple people being present, with folks coming in before they even enter, to know that they don't have a temperature. And what we're using is, if they've got a temp of 100 and stuff, then they need to probably not come into the facility. It's actually a 100.4, but you know, those are things that we look at people and say, no, don't enter. The same thing with the children. They need to be, if they're sick, you need to immediately, once that's determined, they could even come in and be fine and then develop a fever during the day. You need to have somewhere where they can be a place away from other children and immediately contact the parents and get them picked up. They don't need to be there if they have the problems with not just the fever, but any of those symptoms, because they may not have a fever. Not everybody has a temperature. They can just have a cough. So those are things that you need to do. And we do have one that we use from a symptom checker standpoint.
Is that something that you could share with the folks at Voices, and they can add that into this presentation, that screener? That would be really helpful.
We can share the, it's actually a paper one, but CDC has an electronic one that you all could incorporate as well as a symptom checker. And I want to say it may be even up on the Childcare info, but I can send that link as well as the paper one that we use. It's also being used, I think, by DYS. And then I think the prison systems, they're screening also the guards and stuff to make sure that they are not coming in ill to potentially create a problem with the population.
Great, thank you. That was wonderful information. And again, just to let the attendees know, we do see you putting in information in the chat. And again, we are recording this session. While we may not be able to address all of your questions and concerns today in this format, we will put together some information to share post-event. We also have a frequently asked questions document that we've created at Childcare Resources based on a lot of feedback from many of the partners on this effort here today. And we will be sharing that at the end of this session, as well as making that available. And much of the information that you heard shared today, it will also be on that FAQ sheet. So we hope that'll be a great resource for you after this event. Again, thank you, Dr. McIntyre, for sharing information and making yourself available. We're going to switch gears now to something that that may be of interest to many of you on the call, and that is how to access some of the funds and the stimulus resources that are available through the federally approved CARES Act that, as many of you are aware, passed recently. Some of you may have already taken advantage of the loans and such that are available. Today we have some good friends of ours from Center State Bank here in Birmingham, and they're going to share with you some information specifically with regards to that. So I introduce you to now Tim Dolans, and hopefully Jason Bryant is able to join us as well, get us started on this important segment. Thank you.
I'm armed. Good morning. Thank you. Tim Dolans with Center State Bank. I'm the SBA lender for Alabama. And so I'm armed with enough information to be dangerous about the PPP. We are actively processing applications for the Paycheck Protection Program, which is part of the stimulus package passed in the CARES Act. Just a quick overview, there's a couple of different resources that that you can access. The Paycheck Protection Program is probably the most attractive. Is probably the most attractive. I'm sorry, did I lose you?
Just for a moment, it's okay. Continue.
Okay. So the Paycheck Protection Program is a program administered by banks and guaranteed by the Small Business Administration. So the bank makes a loan, but the SBA gives the bank a 100% guarantee. The qualification criteria is fairly open. The idea is that this would be more of a grant than a loan. And so there's an incentive for banks to make the loan. It helps to capitalize small businesses to help them continue to meet payroll, retain employment, and keep our customers in business, and continue to offer a way for businesses to access capital that wouldn't be available otherwise in the situation that we're currently experiencing. So the way the PPP works is there's an application form. You can get it on the Treasury website, but the most efficient way is that to apply for it, there are typically going to be some electronic applications, and that's the most efficient way to apply. The basics of the program are that there's a limitation on the loan amount, which is determined by the amount of payroll that you pay. And that documentation would include the payroll records from a third party if you're using someone to process your payroll, the payroll tax returns. In general, you're able to use either your 2019 payroll as a guide or as a number, or the last 12 months. And so there may be one of those that's more advantageous than the other as far as providing capital. The way that the program works is you take that payroll, let's say for 2019, and you use all of the payroll numbers, and you break it out by employee and salary, and you take an average of those salaries. Anyone who has a salary over $100,000, you need to reduce that salary to $100,000. You can't include more than $100,000 in that average. So average those salaries out and multiply it by 2.5, and that is your that's your loan amount. So that average can include the payroll, it can include the health insurance or employee benefits, time off, things like that. There's some specifics that it gives you, but those are the types of things that you can include in that number. Take the average of that on a monthly basis, multiply it by 2.5. That's the loan amount. You would apply for the loan, provide the documentation that is needed, so that the payroll, tax return, the copies of the payroll records from your payroll provider, and generally either a tax return and organizational documents for business license. You need to provide something showing that you were in business on February the 15th. You take that loan out, and then at some point, the SBA is going to make that you don't have any payments due for 6 months. Somewhere in that time period, that first 6 months, you can apply for forgiveness of the loan. And as long as you can document that you use the money to make payroll expenses, to pay payroll and benefits, and you can use 25% of the loan proceeds to pay rent, mortgage interest, or utilities. So as long as you use 75% of the loan proceeds at least to make payroll and employee related expenses, and no more than 25% on mortgage interest, rent, and utilities, the loan can be forgiven in whole, 100% forgiveness, or in part if you use the proceeds for something other than that. So it's a great program. It has been a little bit of a bumpy rollout, but you also have to remember that the SBA is it's a Herculean task to be able to administer this program. $349 billion in loans that we're trying to get on the street, and we are actively processing them. The thing you do have to remember is that there are still a lot of unknown factors with regard to the PPP, and we're making the loans based on the information that we have today, and but we do have some limitations. Some of the limitations include real good clarification on nonprofit organizations. They can go ahead and apply now, but and with regard to religious organizations. So a child care provider who is related to a church or affiliated with a church, you do qualify, but we need some clarification. So that clarification, the final rules are expected to be in late tomorrow or sometime Monday. So there will be a delay in processing applications for child care providers related to churches and religious organizations for at least a couple of days. So that, just be aware of that. But religious organizations are eligible, which is unusual. Most SBA loans, the typical SBA loan does not allow for that. And nonprofit organizations are also eligible, which is another unique aspect of the PPP. So that's the big news, or the big program. There's some delays just because of the processing, but we are actively working on it. I will say this, that the best place to go to apply for the PPP today is likely your bank, where you currently have a relationship. Center State is, we plan to eventually open it up for non-customers, but our primary responsibility today is to take care of our existing customers, help them get as many through the system as possible, and then to open it up to new customers or new clients, other people who need help. And every bank really is taking that same path. So start with your current bank. If you don't get the help you need, or they can't help you with the PPP loan, then start looking for other lenders. Center State we will get that open up at some point. We don't have a day or know exactly when that will be. There are other banks that are doing that. I know of Bank of America is actively making the PPP loans, and so is Seacoast Commerce Bank. There are several others. If you just get on LinkedIn or Google it, you'll find some that are accepting applications. Either they've already helped all their clients, or they're helping non-customers as well. It's just a fact of the way that the program is working, because there's so much that's unclear about it. So we're doing the best we can. We are actively processing applications, and it is very robust volume on these. And Jason can attest to that. But just to mention it, the PPP is a forgivable loan program, a loan that is made by the bank and then forgiven. There's also what's called the Economic Injury Disaster Loan, which is directly from the SBA. The PPP has some advantages in that it does not require a personal guarantee. It does not require any collateral at all. The Economic Injury Disaster Loan directly from the SBA would require a personal guarantee and would require collateral if it's available. But both of those programs are available. Just keep in mind that you would use the PPP program for payroll and Economic Injury Disaster Loan for other purposes. I would also advise to go ahead and talk to your bank about asking them to defer payments for some period of time. Typically, they will give you at least 3 months. That will help take some of the sting out of our current economic issues that we're facing as a result of the coronavirus. So that's a real quick overview. There's a lot to digest, and I know a lot of questions. And if you will, I'm sure that there's a way to consolidate questions. I can get the answers out to you as judiciously as possible. So.
Great, Tim. Thank you. That was great information. We have just a minute or so for one or two questions that did come in. Does it matter what size your organization is? In other words, we have some folks on the call today, the event today, that are home child care providers. They're kind of like a sole proprietor. They are self-employed, operating a business out of their home. Would they qualify for the Payroll Protection Program, or is it something else that would be better suited for them?
A sole proprietor or even 1099 type of employee does qualify. So beginning a sole proprietor that files a Schedule C today and has a tax ID number, an EIN, can qualify and go ahead and apply now. If you're a 1099 independent contractor, you can apply starting tomorrow. So as long as if you're a sole proprietor and you have a Schedule C where you report your income, you would use the income statement from that Schedule C, or if you haven't filed a 2019 tax return, you would just use a profit and loss statement, and then either a business license or your licensure from the state to prove that you were in business on February the 15th. But those, sole proprietors, very, very small operations, yes, you do qualify for the PPP, and that's what this program is for, is to help really smaller operations more than anything else. The rule of thumb is 500 or fewer employees. For the most part, you're going to qualify. If you have more than 500 employees, there's an alternative size that has to be run and looked at to determine whether or not you qualify. But that's a great question. And there's so many things that, and sometimes unless you're asked, you just forget to add that to it.
And one other question, this will be a nice segue from is, a lot of this is happening very rapidly, and particularly for child care providers, many of them may have had employees to go ahead and file for unemployment before the CARES Act took effect. So if a business already has employees that have voluntarily quit, or the provider had to furlough them or lay them off, will they still qualify for the PPP or any other opportunities at this point?
They will, yes. And I would, you can go ahead and apply for the PPP. Whether or not employees have left, been furloughed, or laid off does not affect your ability to get the PPP. But what it does affect is your ability to have the loan balances forgiven. So there will be there's a time period that the loan is active, and that it ends June 30th. So you will have a comparison of how many employees did you have February 15th, and how many employees did you have January 30th. So the idea
June 30th.
June 30th. The idea is to compare those, and the forgiveness amount will be directly related to your head count, at the beginning, and your head count at the end. So you may have to lay some people off, but the idea behind the PPP is to hopefully speed up your being able to bring them back on board, and that's so that's a good question. I mean, that's an unavoidable consequence of their situation.
Right. Well, again, thank you so much, Tim, for being a part of this today. And now we are going to move to our next speaker, who is a labor law attorney. She is shareholder at Littler Mendelson here in Birmingham, and her name is Janell Ahnert, and she is prepared to talk with you about some of these other issues around unemployment claims, and actually how do you furlough employees. So Janell, welcome, and please proceed.
Good morning. I wanted to start by saying I serve on a board of directors for a nonprofit childcare center here in Alabama, in Birmingham, and I really feel everyone's pain with regards to trying to navigate this situation. It is very difficult, and I completely empathize with everyone on the call and trying to determine how to keep everyone safe and keep everybody paid and come out on the other side of this with your child care center intact. I wanted to mention real quickly before I talk about unemployment, Dr. McIntyre talked about taking temperature checks for your staff. I just wanted to mention that typically the EOC does not allow you to do that. It is not permitted under EOC guidance, but currently in the situation we are in, the EOC is allowing that. And so you can take temperature checks of your employees. I just wanted to mention that so you would realize when we're no longer in the COVID-19 situation, you cannot continue to do that. So that's just a specific thing with regard to COVID-19. You also need to try to find a way, if you are taking temperature checks, to do that when during the same time that you want your employees to be paid for those temperature checks. They're very quick, but it needs to be on paid time. So if you're taking temperature checks before an employee comes into the center, please make sure that you are compensating for that time. Now, getting into layoffs and furloughs, there are unfortunately a lot of childcare centers who've had to either lay off or thinking about laying off employees or furloughing employees. The difference between those two things, we kind of often use those words interchangeably, but what a furlough means, you are still my employee. I intend for this to be a short-term situation, and I will call you back when I'm up and running again. So it's not a termination of the employment. I will say first, as when you're trying to determine if you should furlough or lay off employees, that you are mindful if you are applying for that CARES Act, that PPP loan, that it could impact your ability to have it forgiven. So just keep that in mind, particularly if you are part of an organization and you're not necessarily aware that someone else in the organization is applying for that loan. Just make sure your left hand is talking to your right hand and that you are coordinating that effort. In addition, if you have more than 100 employees and you are needing to lay off or furlough, up to 50 employees, then you should speak with a lawyer. Most of you are smaller than that, and most of the child care centers I've worked with are smaller than that. But that's just a disclaimer for you to talk through. There's something called the WARN Act, WARN, and with regard to notice for furloughs or layoffs that involve a large group of employees. Now, getting to unemployment, the CARES Act has extended unemployment in the state of Alabama. So what that means is typically in Alabama, you can apply for unemployment, and you have to, if you qualify and are eligible for unemployment, you would get $275 a week for unemployment. That's the maximum. So if you make less than that a week, you would get less than that a week. Are y'all able to hear me? There just seems to be a lot of feedback in my ear. Yeah, I'm hearing a lot of feedback and echo too. Okay, I'm gonna keep going then. I've heard that y'all can hear me. So if the maximum available in Alabama is $275 a week. Currently, with the expansion by the CARES Act, in addition to the amount from the Alabama state unemployment, you can also, employees would also be eligible for an additional $600 a week from the federal government. So that's a huge expansion, and that $600 a week is if you qualify for even up to just $1 a week for Alabama unemployment, you would get the additional $600 a week. So individuals who are unable to work due to COVID-19 can get up to $875 a week in unemployment benefits right now. They've also they've also expanded where there is no longer a waiting period, and in addition, you do not have to look for unemployment. Usually if you're on unemployment, you have to look for new employment to see if to qualify for continued benefits, and that is no longer the case in Alabama during this time period. Now, unfortunately, a lot of child care centers are either 501c3 organizations or are part of religious organizations. When that is the case, those nonprofits do not always pay into the state unemployment pot. The way that unemployment works is each employer through the IRS pays taxes, and those taxes go back to the state and they fund the unemployment. And so if you're not paying into the system, typically you're not able to get the benefits. So in Alabama, 501(c)(3)s still pay into the system typically, but there are some exemptions from that. And that would be if you are, for example, a church or part of a religious organization. So what you want to do before relying on the ability for your employees to obtain unemployment, you want to check and make sure you are paying into the system first. You certainly do not want to think, oh gosh, if I can lay off my employees, they're going to get up to $875 a week, and then find out they're not getting anything because I don't pay into the system. Now, if you do not pay into the system, if you're part of a church or your 501c3 for some other reason is not a part of Alabama's unemployment insurance system, you should, and you need to go ahead and lay off or furlough employees, you should still have them file for unemployment. Well, Alabama sent out a press release saying everyone should go ahead and file, even people who are independent contractors, people who do not typically have, who are not typically eligible for unemployment, like church employees. Everyone should file, because that CARES Act also has expanded the federal unemployment benefits in order to get the extra $600. The way you get the extra $600 is to file for Alabama unemployment. And you can do that either on the phone, or really the website is much better than trying to get through on the phone right now. And so it is best to just, if in doubt, file. If you're not eligible, your employees aren't eligible, they will tell you that you're not eligible. If you filed before the CARES Act went into place and you were denied, you should communicate with unemployment about refiling that claim, because you may be eligible for the $600. You may not be eligible for Alabama unemployment. You may not get any of the $275, but the way the CARES Act is designed to work is if it, with the expansion, you could still be eligible for the $600 a week. Currently, as you can imagine, Alabama unemployment, every state is very backed up. They are, it's hard, and everyone's going to have to be patient. Typically, there's a waiting week for a week before benefits start. Here, that waiting week has been waived. However, there is an issue with how long it's taking to process. The best thing to do is, if you have to lay off a mass group of employees, 25 at a time, that you file for all those employees online as the employer, and you code it as COVID-19. Everything that's coded as COVID-19, there's not going to have to go through the process of confirming it with the employer. Does anyone dispute that this is eligible for unemployment benefits? If you do that, that will definitely speed up the process, but it is still taking a long time for the benefits to start. And as of today, we're not aware of anyone receiving the $600 in federal benefits yet. However, we expect that you want to file as soon as you can, because if you wait, those benefits can be back paid, and they only go through a certain period of time. So I think, Joan, that's probably about all I've got, unless you want me to answer some specific questions. I'm not hearing you, Joan.
Hold on one second.
Okay, I hear you now.
Thank you for that great information. And again, for those of you on the webinar today, Janell does have some handouts to clarify the information that she shared. So that is available as well in the handout section, which should be near the upper right-hand corner of your screen. If you see the chat tab, then you just go over 2 tabs, and then you'll see the handouts tab. We're just going to take a couple of quick questions just to clarify. How long does an employee have to have been an employee before they're eligible for benefits? And I just want to also ask, many of these childcare providers could actually make more money through the unemployment benefits with the additional $600 than they're currently being paid. So should they actually be laid off so that they can access these benefits? And one other question is, many of these childcare providers have a second job. So if the provider is paying them right now, continuing to pay them, but yet they've been laid off or furloughed from their other job, how does accessing unemployment benefits apply there? So that was 3 rapid fire questions there. If you need me to repeat any one of them, let me know.
Yeah. And one thing to point out is, if an employee is furloughed and not actually terminated or let go, they can qualify for unemployment benefit for these benefits right now. If they are unable to perform work because of COVID-19, then they are eligible for unemployment benefits. It doesn't have to be a termination. Now, employees do have to have worked for a while to typically be eligible. So to get Alabama unemployment benefits, they have to have a certain amount of wages in 2 of 5 quarters. And those quarters, I think currently right now, go back to, I want to say, August of 2018. And so if someone has just started, they're not going to be eligible for Alabama unemployment. However, I would still encourage them to apply because the CARES Act was designed to expand unemployment to provide benefits for people who typically are not eligible. And so they may be able to receive the $600 from the federal government, even though they are not eligible under Alabama's unemployment. We're still waiting to see how that process works. Again, as of right now, no one has received the $600 from the federal government in Alabama, and we're waiting to see how Alabama processes all that. But that's our understanding of the CARES Act. I'm sorry, Joan, what was the other question you
If
had?
someone has a second job in addition to their childcare job, and the childcare is still paying that employee, but their other job has wages, how does it apply for unemployment?
Yes.
Right. So Alabama unemployment is going to look at what they're earning and how their earnings have been reduced. Your earnings don't have to go to zero to receive unemployment benefits. So, for example, if your hours that you're working have been reduced enough, you can be eligible for unemployment. The big ticker is you can't make more than the Alabama weekly benefit. So if you are still earning more than $275 a week, then you're not going to receive additional funds from Alabama, but you may be eligible under the CARES Act for the additional $600 for a reduction in your hours.
And just to be clear, how do people apply for the federal portion of the CARES Act? If you could just share that one more time, and then we will move to our final speaker.
Right, you apply just like you apply for Alabama unemployment. So you would either call the unemployment office or or apply online, and then they would determine, are you eligible for Alabama's unemployment, and if not, are you eligible for the federal portion under CARES Act.
Great. Again, thank you, Janelle, so much. We appreciate your valuable information. We are now going to move to our final speaker, who is another great friend of mine, Jacob Smith. He is the Grants and Research Director for the Women's Fund of Greater Birmingham, and he has an exciting opportunity to share with all of you today about some local funds. You've heard a lot today about federal funds that are available and even some of the state unemployment funds that are available. Jacob is now going to share with you information about some local funding that, while they are in Birmingham, is available across the state. And so, Jacob, it's great to see you, and thank you for being a part of this. And now I'll allow you to be our final speaker, and then at the end, I will come back to give up some wrap-up instructions and talk about our frequently asked questions document we'll make available to you all today. Thank you, Jacob.
Yeah, thank you, Joan. First of all, I want to thank Voices for hosting and getting this call together, and Childcare Resources, and Joan, who is a good friend, but also the Alabama Department of Human Resources and the Alabama Department of Public Health for their leadership in this very difficult time. As Joan said, I am Jacob Smith, and I am the Grants and Research Director for the Women's Fund of Greater Birmingham. The Women's Fund is a public foundation, and our focus is on accelerating economic opportunity for women, both in our Birmingham region, but also across our state, as Joan mentioned. So we use a three-pronged approach. We do targeted grant making, we do research on issues affecting women, and advocacy with women's voices at the center. And the Women's Fund, our approach has always been to use a gender lens, meaning that we target our work to organizations and services that are specifically responsive to the needs of women. And at the Women's Fund, we recognize that parents and children do not act in vacuums from each other. Families act as units. And so what affects parents affects children. So that's why we have always had a focus on childcare as a piece of our work, because we care about mothers. And so when the COVID-19 pandemic began, Of course, the first thing we did was take care of our team, but then we started listening to the community. Both through talking to our existing grantees, families themselves, and then, of course, we had conversations with our fellow funding partners to see what their approach would be. And we found that the lane where the Women's Fund could have the most impact was childcare. We heard that repeatedly and resoundingly. And so within a couple of weeks, we launched the Roar for Women Fund, and Roar stands for Rapid Operating and Response. And so this fund is going to give grants to help childcare centers stay open and or reopen during the COVID-19 pandemic. And so our funding is relief funding and gap funding. We are glad and applaud the federal government for providing those relief dollars that you just heard about. We know that they're going to be large and critical, but we also know that there are needs now that may not be covered by those dollars. And so the Women's Fund's grant dollars are flexible last dollars that can help fill needs now. As a place-based foundation, we know that a local and state response are key during the crisis. And so that is why we are taking this approach. So we're doing our best to work quickly and get these dollars out now with quick turnaround time. So I just want to share a few details of those grants now. The request for proposals, which includes the grant application, is available now. And I think I actually just saw it pop up in the handouts spot, so you can get it there. Or you can find it later on our website, womensfundbirmingham.org. Right on the homepage is the Roar for Women Fund, and you can click through there to find that application. Roar for Women grants are up to $10,000. You can ask for any amount up to that threshold, whether it's 1 to 2 months of operating or if you have a specific need. We want to know about it. And so who is eligible? Any Alabama DHR licensed childcare centers, family daycare homes, group homes, or accepted, meaning those that are regulated by another state or federal entity. So we are prioritizing centers that are serving children with essential employees, which is everyone, which is any operating center in Alabama right now, I believe, but especially those that are serving new children of essential employees and are helping fill the gap and have a plan to fill those slots. And then finally, we're prioritizing centers that are located in areas of the state most affected by the pandemic. And so we will be awarding grants on a rolling basis to childcare centers. In fact, we're going to make our first award notifications tomorrow. And we've had a great amount of interest. So if this is something you would be interested in, I encourage you to apply quickly. And when you apply, to really highlight how you are fitting our priority interests and meeting the needs of essential workers, and mentioning how you're working within those CDC guidelines and with the public health orders. So we're reviewing applications on a weekly basis. And so for strong applications, we'll be awarding funding potentially within a week and definitely less than 2 weeks after receiving the application. And of course, we'll be holding on to the other applications as more funding is available. So we've had a huge amount of interest, but I am trying to answer questions within a couple of days as I receive them. So please don't hesitate to reach out to me. My contact information should be on that RFP. It's also on our website, and we want to hear from you. So the last note I want to make is that we are adapting and evolving just like you. And so please keep us up to date on what's going on with your centers and what your current needs are. We want our philanthropy to be responsive, and so we want to hear from you. So thanks again to DHR Voices and Childcare Resources and the Department of Public Health. And then thank you to all of you who are on the call, because you are the front lines of this work right now. And so we are just glad to be a part of this critical work in our state. So Jen?
All those on the call to refer to the handouts that were also part of this. We have one final handout for you today, and that is our frequently asked questions document, or also called an FAQ. And again, much of what you heard shared today from our variety of terrific presenters is included in this document, including phone numbers, some links to websites that have helpful information to support the information we shared with you today. At this time, again, I want to reiterate that we truly do appreciate what you all are doing across our great state of Alabama for families and children during these extremely challenging times. We truly hope that the information shared today will be valuable to you and your businesses, your staff, and your families. And we do encourage you, I've heard from many providers that they're sort of operating virtually. They're contacting their staff regularly to check in on how they are doing. They're asking them to develop lesson plans and share those with their families. Some programs are using tools such as Zoom. It's another online webinar type platform like this. Some are using phone calling, some are using FaceTime and those kinds of things, Facebook Live, to continue to connect with their families, to share information, to let them know that they care. So there's a variety of options out there, and I would encourage you, because we do know many of you are concerned if your families will return when we do get back to more of a normal operation, as we are hoping and looking forward to. And also your staff, wondering if they will return. We know that's a big question for a lot of you. So the more you can stay in touch with them now, your families and staff, that will greatly increase your opportunity of having them return when we get going again here, hopefully soon. Again, just want to let you know that this has been recorded. We apologize for some of the technical difficulties. The recording may actually be better than the live presentation. So please feel free to visit that recording and know that those handouts will be there as well. We did see a lot of your questions come in today, and our hope is that when we send you post-event information, we will work to provide some additional information regarding to those questions. I want to again thank our host today, Voices for Alabama's Children, who so graciously provided this platform today and organized the whole format that you saw today with our presenters and their introductions and everyone being able to participate. I want to thank all of my great friends that were presenters today: Stephen Warner, Jennifer Cannell, Stacy Sorrell, Dr. Mary McIntyre, my friend Tim Dolans from Center State, Janell Ahnert from Littler, and of course Jacob Smith closing us out. As you heard some of the presenters share, many of us, like myself, have utilized or maybe even currently utilizing childcare. Many of us are parents and have had to rely on you all for care so that we could go to work every day. And we appreciate what you have done and continue to do to support families and your staff during this very challenging time. That is all the information. I'm just checking my notes one more time. We're going to work to try to get you that CDC symptom checker. That was something else that came up during Dr. McIntyre's presentation. We'll work to get that out post-event. And we invite you to please share the post-event link with others who may want to revisit this information. Please continue to stay tuned. As more information becomes available, we will push it out. And we thank you so much for your time today. And at this, I will conclude the webinar and wish you the very best and a wonderful weekend, especially for those of you that may be celebrating religious celebrations this weekend. We hope that they will all go very well for you from more than 6 feet away. Thank you and have a great day. Bye-bye.